share with us the latest, greatest information on what's happening here locally and what we need?
Absolutely, Ken. And there's a lot of things happening, and there's a lot of mixed messages, and it gets updated all the time. So we'll try to give you the update as of what time do we have here? 6:04 on Wednesday evening. One of the things that I follow, as many people do, is the information that comes out of the University of Washington School of Medicine, where they have the Institute for Health Metrics Evaluation. And they continuously update models, just like when we have a hurricane, you see all those different models, the European model, the California model. There's a lot of models now tracking the direction that COVID is moving. And the Health Metrics Evaluation Institute up in Washington is the one that's considered perhaps the gold standard. In terms of the statistics in Florida and the direction things are going, I think it's important to pay attention. It's also important that you have to realize that these are models, not necessarily reality, but it's probably the best thing we have to work with at this point. A few weeks ago, the model, along with a lot of my colleagues I was speaking with, said that most likely the cases in Florida will be peaking out somewhere towards the middle of May. Last week, the Institute said that it appears that Florida will peak in terms of the number of cases per day, new cases, deaths, on April 23rd was the prediction a week ago. And they said approximately 239 Floridians would die each day during this peak period. Now, 2 days ago on Monday, those figures were changed again. Now they're saying that the peak in Florida is going to be a little bit later, more like May the 6th, with 128 deaths a day. So less people dying 2 weeks later, but if you look at the entire curve, they're actually predicting that there'll be more total deaths in the state of Florida over the next few months. Clearly, there's a lot of uncertainty. They're working with a lot of different figures and factors. That's how they come up with their statistics. They look at such policies as travel restrictions and people wearing masks, stay-at-home orders. They're looking at the number of available ICU beds, ventilators, and most recently, they're looking at data coming out of Spain and Italy, which has reflected that after the peaks, the fall off in the number of deaths per day has been pretty steep. So that's why they're changing their figures in Florida. At any rate, you can't emphasize enough, there's a lot of uncertainty, but the latest is that this is going to be, we won't see a peak for at least several weeks. So they're looking at May the 6th, so about three weeks down the road. In Palm Beach County, the latest statistics show that we've had approximately 1,800 cases. That's just people who have tested positive. We know there haven't been a lot of people tested. 306 people have been hospitalized for COVID. There have been, as of this afternoon, 105 deaths. One of the optimistic points that's been pointed out in the media is that the number of new cases daily seems to be diminishing. I guess it depends where you actually draw the line on the graph, but if we look over the last 4 or 5 days, on Friday of last week, there were 69 cases. Saturday peaked out at 180, probably because they opened up some new testing sites. So those figures just reflect people being tested. Sunday, 55, Monday, 58. Yesterday was 48 cases. So we're at a trend where at least it's not shooting up rapidly by any means. The local people, in terms of the things we're worried the most about down the road, could be things like patients getting very sick and having to be hospitalized, put into an ICU, perhaps on a ventilator, to the extent that measures have been taken locally to set up, be ready to set up a field hospital at the South Florida Fairgrounds. But now the word is that we may not even have to use that, which would be a great thing. But it seems that we certainly are in a situation where on the hospital level, particularly with some of these emergency beds and the utilization now that is available in the hospitals, since they've canceled literally all the elective and non-essential cases, there seems to be a lot of space available if and when we get this large surge. So that's good. Hopefully we can see a much more positive experience than they've had in places such as New York. Other interesting thing that came out in the past week, one of the questions that I have been asking a lot, and now we're beginning to hear answers, is how long is this going to go on for? And at which point are we going to say, okay, we're safe, we can move on? There was an interesting comment made by our state Surgeon General, Scott Riefkes. Dr. Riefke is up in Tallahassee. This was, I think, part of some type of press briefing with the governor late last week. And Dr. Riefke said that he thinks we're going to really just have to get used to all the things we're doing now, the precautions, avoiding crowds of 10 or more people, wearing masks in public. He basically said this is going to be the new normal for a long time. When asked how long is a long time, he says until a vaccine is developed, which could be many months or even more than a year. At which point he was whisked away from the press conference. But those comments were captured by all the media all over the place. But I think it's a really important statement because this is the question that's asked all over the place. I certainly asked that question. It's like one day we say, okay, it's all over. We can move on. And clearly it's going to be a gradual process. And I really respect those comments that he made. I think that's an important point. So that's a little bit of the update from the medical point of view. We'll turn it back over to you, Ken.
Hello.
Thank you, Brent. Before we go to the Congresswoman, do we have any quick questions for Brent? We can always come back to him later, but any questions right now? Thank you, Brent. And I've got a couple of questions, but I also am eager to hear from Congresswoman Frankel on, I don't think it's too much hyperbole to call it a massive spending bill, but we also know that's what it takes to provide the help needed. Congresswoman Frankel, can you tell us what is in that package? How is it going to help us to be better?
Okay, thank you. So good to see all of you. I hope everybody is well. My friend Carol, you're all the way in London, is that right? Excellent. She doesn't know how to unmute, I think. Anyway, thank you for having me join you tonight. And just to let you know that your members of Congress have been working every day, all day, on all kinds of calls to try to figure out how we can get more relief to Americans. There are a lot of people, as you know, who are really suffering, not only people who either themselves or a loved one is ill, but the financial crisis is starting to hit a lot of people hard. We have a area where we have a lot of hospitality workers, and they have been off for a lot of weeks. So I'm going to start with some good news, and that is today, 60 million Americans were supposed to get their relief check if they're earning up to $99,000. They should have gotten a relief check in their bank account today if IRS has their bank information. The bulk of that money is going to go to people who have earned up to $75,000, or married couple up to that would be twice of that, $150,000, plus $500 for every child who's under 17. And if you have previously filed with IRS and they send you your refund or they have your bank information, that money is being directly deposited into your bank account. If you earn more than $75,000 but less than $99,000, you will get a reduced benefit. Now, for those who have not given IRS your bank information, you will be eligible for a check, but that's going to probably take a number of weeks. So my suggestion would be that you can go on the IRS webpage. Let me see if I can find that for you. You go on the webpage at irs.gov/coronavirus, and you can put in your payment information so that you can get a direct deposit. If you're on Social Security, you will get your check the same way you get your Social Security check. And again, if you're getting your check in the mail, I urge you to give IRS your bank information. So that's today. It'll be helpful to a lot of people. Secondly, what I'm gonna do, if it's okay, I'm gonna touch on some of the economic issues first, and then if you want, I'll tell you where some of the large tranches of money are going. For anyone who has a small business, there are really two new programs for you. The first is called the Paycheck Protective Program. God, I've had so many of these calls that I can't even get it straight. No, I'll call it people. Oh my God, I think I'm having a tongue twister here. So the paycheck.
I think you meant payroll protection.
What can I say? The Payroll Protection Program. Okay, this is for small businesses under 500 people, and there's some exceptions in some industries. You can have more than that. And basically what it does is it allows an employer to keep their workers paid, not necessarily working, because a lot of these businesses that are going to take advantage of this are not open for business. But the idea here is to keep your workers employed, so that when you are ready to reopen, you have them. You're not looking for them, and it also keeps them from having to go on unemployment, which I'm sure most of you heard is a nightmare right now. I'm trying to even get on unemployment in Florida, and I'll talk to that in a second. But the Payroll Protection Program. You get into it through your bank. They can give you the guide, and you can go to the SBA webpage, and they can give you the guidance of what kind of questions or what the application is going to look like. Now that's the good news. It's a very good program. The caveat is this: it's such a good program that the money is being depleted and probably will not last past till tomorrow. So as we speak, I know that our leaders up in Congress are trying to negotiate an extension of that program with some other items that I know, not necessarily partisan, that some of us are pushing. And what we're pushing is this: additional funds for this small business program, one. Number two, more money to come to our community health centers and our hospitals, our healthcare system. More money for local governments that are about to really get hurt because they are not going to get their property taxes, so they really need help. And more money for our food program for people who can't afford food. That's through the SNAP program. So those are the four things that some of us are pushing for. And I hope that by early next week, Congress will have passed new legislation. The reason we have to find something that we can all agree on is because Congress cannot go back to Washington, and so we have to find something that is very, very bipartisan. So that's the other program for anyone who has a small business. It's a very good program. Again, it's called EIDLE. That's the acronym for it, EIDLE, and you get that through SBA, and that is a very cheap loan program. But the beauty of it is that you can get $10,000 that you don't have to pay back very quickly. And on the payroll, the PPP effort, that also, if you use it for payroll, rent, and utilities, that's also going to be free. You're not going to have to pay it back. So there's more details of that, but I'll tell you what, if anyone who's interested in the Payroll Protection Program, go to my Facebook page, and we did a 1-hour question and answer with the head of the local head of SBA, and he gave very good detailed information that I think if you had any question of how to navigate as a small business person, all the questions have been answered. The third item I wanted to talk about in regards to the financial relief is on unemployment. as you may know, Florida has the stingiest unemployment practically in the country. The benefits are extremely low, and the time period is extremely short. We're one of seven states that have unemployment of only up to 12 weeks. Most of them have up to 26 weeks. The maximum they'll give you is $270 a week. That's not even minimum wage, not even close to being the average salary for Floridians, which is about $52,000 a year, about $1,000 a week. So Florida is very, very stingy in that regard. There is, however, some good news that I'll give you, and that is the federal benefits in our most recent CARES package is going to supplement everybody's unemployment by $600 a week extra for 16 weeks. And we are also going to pay for an additional 12 weeks of unemployment. And that's if Florida can get its act together to accept these benefits. Anyone who's been trying to get on that webpage knows it's been a real mess. Although they have promised to hire literally hundreds and hundreds of more people in order to get through everybody's claims. So be persistent, and you should get your money. So those are the basic economic issues that we dealt with. Now, just to for some, where you're actually still employed, we put into place an emergency sick and paid leave program. So if you're interested in that, again, I just say go to my webpage and it's on there. You can click on and see what that is. But basically, the paid leave for anyone caring for a child can take up to 12 weeks at a maximum of $200 a day. That's $10,000 total. Sick leave for anyone who's seeking a diagnosis for COVID or caring for a family member or a child can get up to 2 weeks at $511 a day for personal care and $200 a day for family care. The beauty of that program is that the employer gets a full tax credit. So this is a free program for employers and employees. Anybody who works with someone who has less than 500 employees is eligible. There are certain exceptions for businesses that are considered essential businesses. You asked me, what some of the, I lost you where you went. Oh, there you are, Ken. You asked me where some of the other big pockets of money, we sent money back to the healthcare system. We've sent money back to the education system, especially to help students with loans and to try to get them ready for virtual learning. And I think those are probably the biggest items. I don't know, Josh, are you still on there with me?
Yes, Congresswoman, I'm here.
Oh, Josh, did I miss any of the bigger items that
No, Congresswoman, I think that's a perfect overview, and then you can get into questions and answers with the guests on the call to get into their specific concerns.
The last thing is, anyone who's on Medicare, we did make the use of the telemedicine in a lot more different areas so that people could use that. I think, Dr. Schillinger, you probably know that too.
Right.
All right, why don't I just take some questions, folks?
Well, Congresswoman, I've got quite a few questions coming in on the chat line right now, and many of them are state issues, probably better handled by the legislature, but I can give you a sampling of some of them.
Okay, go ahead, give me a shot.
About how can we get the county and state to stop, take measures to stop foreclosures, electric and water utility cutoffs and stuff like that. I'm correct, that's a state issue, correct?
Yeah, I tell you, we've had this, I will tell you, we've had discussions in Congress. There is I'm gonna use a lifeline. I feel like I'm playing that. What's that game where people play and they sit? Who wants to be a millionaire? Okay. I use my lifeline to Josh, but I'm pretty sure that that if your mortgage is backed by
Fucking asshole. Another asshole.
Something, I don't know. If your mortgage is backed by the government, it seems to me that you do not have to pay your mortgage right now. Is that, Josh, you want to take that from me?
Yeah, the guidance we've been getting, obviously you and others in Congress have been focused on this issue. The guidance we've been getting is that in the near term, you're not going to be kicked out of your apartment or water shut off. That's one of the things we've been focused on. But just to remember that the payments will still be due when this crisis abates. So from a economic planning perspective, it's important to keep that in mind.
But I do think there is a special program for federal-backed mortgages. But not that it will be free, but it can be delayed. Okay, he's going to look that up. Next question.
Okay. There's appreciation expressed for pushing for an extension to cover community hospitals and local and state governments, and the work with the SNAP programs to allow SNAP and the EB cards to be used in ways never authorized before. Do you see any other areas like that that need to be worked on in order to provide some relief?
Well, there's the old cliche, it's a domino theory. Yes, there's so many impacts to this coronavirus. It's almost, we could probably sit here among all of us and just come up with literally thousands and thousands of impacts. But getting to an agreement on what to tackle next when Congress is not present, and where you need to have a unanimous consent, it is very, very difficult to find all the different items that we want to tackle. Now, for example, there are plenty of people who would like to tackle the rent issue, maybe the utilities issue. That is not something that we're going to get probably unanimous agreement on right now. It's definitely on the putting more money into the business program, the one that I maligned its name, the PPP. We will put money in there, but myself and others are pushing hard to get the money also for the health, the community health centers, the hospitals, for the local governments, and for SNAP, for the food program. And I think that's probably, if we can even do that by next week, that'll be good. But there's no question there's going to have to be more relief. There's no question at all.
Well, I understand how difficult it is for you all to work under these conditions, especially remotely, trying to work through these issues. I've got several questions here about Britt. Can you still hear me okay?
Yes.
I can. Somebody just.
Yeah, something just dropped. I don't know what happened, but anyway.
Rosa Maria Montenegro, I think you accidentally are sharing your screen. If you click at the top of the screen, you can click the stop sharing button.
I didn't even know. I didn't even authorize
It's
anyone.
a little confusing. Yeah.
Thank you. I couldn't see that one. Okay, so a couple of questions here deal with, you were talking about the payroll protection thing for businesses, and several folks say, what about the folks who don't have employees, as well as one?
Okay, that's fine. That's a good question. Yes. So just to let you know now, independent contractors, people who are self-employed, you really have two options. You can either go the unemployment way, or you can go the PPP. And here's what would be the deciding factor, really, is if you are self-employed and you make an income that's greater than what you're going to get on unemployment, and you have either a mortgage or you have utilities, you have business expenses that you want a loan for, you can apply for the PPP. Now, there are some self-employed people who don't take their salary until the end of the year to see when they make a profit, or they work on a commission. The way your benefit will be calculated is you will take a look at what your income was the previous year. That would be 2019, and that will be divided by 12. Okay, let's say I got my math right. That's divided by 12, and then that is multiplied by 250%, and that is what your loan you'll be eligible for that loan. Did I get that right, Josh?
Yes, that's correct, Congresswoman.
Okay. So then you can pay yourself, and you can pay other business expenses. Now, here's the catch to that. This loan, it's a very good loan. It's either if you pay your payroll, your rent, utilities, all that is a free loan. You don't have to pay it back. If you pay anything else, it's a 2-year loan at 1%. So that's pretty good too. The other option, if you are self-employed, you can go to Florida unemployment, and you will get the $600 a week for 16 weeks. And then you should at some point get Florida unemployment if they get their act together.
So before I read any more questions from the chat, let me unmute. Are there questions from the participants?
Yes, I would like her to elaborate a little bit more about the telemedicine for Medicare patients.
Okay.
Like how we can do it, because I've got a number of issues I need to take up with my doctor, but nobody wants to meet in person, and I am on Medicare.
Okay, that is correct. And I'm going to try to get, whoops, I think I got out of the screen. Okay, let me find the exact couple things here. On Medicare. A couple things. The CARE Act will ensure that Medicare beneficiaries have no cost sharing for the COVID testing and vaccination. Well, the COVID testing is supposed to be free for everyone. Don't let anybody charge you for that. It also allows the Medicare beneficiaries to obtain 90-day supply of prescription drugs. And on the telehealth, the CARE Act expands access to health coverage by enabling Medicare patients to access telehealth services from a broader range of providers, and would increase funding for grant programs to provide additional telehealth services and capacity. And maybe Dr. Schillinger, I don't know if you can help us with that, but what this enables your doctor to do is they can get paid by having a teleconference with you. It expands what they could do before. And while I'm on this, let me tell you something else for anyone who's on Social Security. The CARES Act waives the 10% early Social Security withdrawal penalty and allows individuals to take up to $100,000 from Social Security during the pandemic for expenses related to COVID-19. So that's your senior benefits, as well as the direct payments that I talked about today, and unemployment if you are employed and now unemployed.
Ken, this is Karen. I don't know if you can hear me because I don't have a little hand where I can.
Loud and clear. Yes, we can hear you.
Go ahead, Karen, yes.
Okay. I'd like, Lois, what is the procedure that Florida needs to take? Can this be done by executive order of the governor because it's an emergency to extend unemployment, or does it have to pass the legislature?
We've been debating this, but I believe I won't say me taking me personal, but there are many of us who believe the governor can take the action through emergency action.
Is this something that the league could have some influence in by
Well, you can,
telephoning his
we
office?
sent, that's a good, you know what? I think what would be good is I'm going to share with you a letter that I sent with some of the members of our delegation, state and federal, to the governor that outlines the actions we believe he should take. Is my, Felicia, or I don't know, Morgan, is the letter on my webpage?
Yes, the letters are on the webpage.
Okay, so
Great.
if somebody wanted to see the letter, what would they have to do? They go to frankel.house.gov. Hello, Morgan.
Yes, they go to the webpage, frankel.house.gov, and I will
And
find
then
out
what do they click on?
the coronavirus.
The coronavirus resources?
Yes, there's everything on
Corona-
there regarding, it starts off.
Okay.
You click on, it starts off with the statewide order and testing and the county.
All right. So you can actually even
Thank
do it
you.
from your, you can actually go do it from your cell phone if you go to my webpage, frankel.house.gov, and you click on, you'll see coronavirus resources right at the top. And then there'll be a list of all the different programs. And then it's somewhere along the way, you can click onto the various letters that have been sent. Is the letter to the governor, you know what? Is it identified what the letter is? Because it's one of our latest letters to the governor. Can they tell just, or that I don't want them to have to click on everything. Can they tell by just,
I'm looking at it now,
clicking on-
and I'll let you know. I'm navigating.
Congresswoman, sorry, this is Josh Cohen. Congresswoman, for those online, if you go to the Congresswoman's website and go to her media center and go to her press releases, scroll down a little bit, you can see all of the letters she sent and other actions that she's taken, including this letter to the governor calling on him to do more to increase the payments, both the frequency and the amount of payments for unemployment benefits.
Thanks,
Okay,
Josh.
Josh, but do they have to, are they gonna have to click through all the letters? Or is it pretty evident which letter they need to click on? Can you just tell them the date of that letter?
Yes, definitely. If you there are several letters, but they all say Rep. Frankel, Florida members send letter to Governor Ron DeSantis urging action to fix unemployment
No,
insurance
Josh, just
program.
tell them the last letter. They don't
March
have to click through all
26th.
the-
Josh, can you send a copy of that letter to Ken Thomas? And then
We'll
we
send
could
a
disseminate
copy
it.
of,
Yeah, I'll
we'll
send it
send a
right
copy
now.
of all the letters to Ken so that he can share it with the
Thank you.
Okay.
Hi, Lois.
Okay.
Carol Moore. I'm talking now. Can I ask you a question?
Hi, Carol. Yes.
Hiya. Testing. I mean, this seems to be something in the last few days that's come up as something important to get us moving and lifting things. But there's such a shortage of testing materials. Did any of the congressional bills provide funding? I mean, Trump keeps saying it's a state issue, but clearly, the states can't do it on any great scale. Doesn't the federal government have to take the lead on testing to get this moving? Thank you.
Yes, okay, it's a two-part question. Yes, the Congress has provided lots and lots of money for tests. The president has refused for a reason. I'm not going to expect this is supposed to be nonpartisan, so I will not give you my opinion why the president is not doing it, but I disagree very strongly with the fact that the federal government is not taking the lead, not only in forcing the manufacturer and getting these tests and then getting them distributed. And so that to me has been a real failure of leadership. I wouldn't matter if he was a Republican or a Democrat, just it's a failure of leadership. I will tell you that I don't know if you all watch either the press conferences of the president or Ron DeSantis or whatever. here's what governors and the president, what they're very good at doing. They keep saying how much of this and that they're sending out. So it sounds like, wow, they're really distributing so many tests, so many gowns, so many masks. If there was real transparency, what they would say is, but here is the need. And I can tell you that the need is not being met. And nurses, especially all over this country, feel abandoned because they're not getting the gowns and the masks that they need. And if we want to get back to, I'm not going to say we're going to get back to normal yet, because I do think we're going to need a vaccine and therapeutics. I mean, it's not what I think, it's what healthcare people are saying. If you need a vaccine and therapeutics to get back to any kind of normal life, until that happens, for people to even even know whether to open up your society, to tell people you can go out and not stay home, even though you're going to socially distance, there has to be a tremendous expansion of testing. I mean, expansion. In Florida, we have 20 million people. I don't even know if has even 1% been tested yet, Dr. Schillinger?
It's approximately 1%.
Okay, 1%. So think about that. 1% of Florida has been tested, and they say 30% of the cases are not you don't have any symptoms. So I mean, right, asymptomatic. So there's got to be, and you can't just have, just the drive-through tests. We have a drive-through site at a ballpark, a drive-through site down at the South County. We've got a couple of, we have Found Care doing some testing. But to really get out in the community, I mean, we're going to need mobile testing. We're going to need, we need mobile vans going out. We talked to someone yesterday who lives in Century Village in South County, where there's thousands of people. They don't even, most of them don't have cars. They're very elderly. They're not, what are they going to do? Hop in an Uber and go to get tested? No, that's not what's going to happen. There are people in urban centers, places where they don't have cars, they don't have transportation, and there's a big impact, especially in these urban centers. So we've got to figure out a way to get the tests, hopefully get simpler tests, because the nasal testing requires the person doing the test. They're like dressed up like astronauts. I mean, it's unbelievable. So, what's going to happen is going to have to be maybe more tests that are self-tests, that are easy for people to do, whether they're spitting on something or an easy swab. Just a lot more testing has to happen, and there has to be a lot more leadership at the top. But getting back to your original question, yes, Congress, we have put in the budget, and we will continue to put in as much money as we need for these tests.
Congresswoman Frankel,
agency.
this is Nancy Gal. Brent?
Yeah, hello?
Brent, it's Nancy Gal. What happened to Abbott's point of care testing?
Okay.
That was supposed to be so fabulous. I even told my financial advisor, buy Abbott, but I haven't heard anything about it, and it still takes 5 to 6 days. That was supposed to be 15 minutes.
Well, it's a little bit confusing, but the Abbott test is, from what I understand, one of the antibody testing methods, which is completely different from the PCR method, which has been used up to now. And what's a little tricky is we don't have a lot of data as to how useful these tests will be. They're better than nothing, no question about that. They're probably very good, but there's about 70 different companies who have products now before the FDA. Only one has been approved, but they fast-track them to pretty much allow anybody to be marketing these products. So they just appeared, I believe, this week in Florida. There's been a number of stories on the news. It's a finger prick test, so it's a fairly simple test. You can get results on that test in a few minutes, but it's a whole different concept. not necessarily better or worse. Some people may think that this may actually be a better concept because you're measuring antibodies to the virus. So if it comes back positive, it can confirm that you were exposed and that your body has developed antibodies, and that you are probably someone who won't be susceptible to another infection. But that's another piece of controversy. We don't know. Just because you have an antibody, how long will you be protected for? But those tests are going to be, I think, over the next few weeks, we're going to see a lot of that available. So that will give us some data. One of the other confusions I'll mention with the PCR testing, which has been done up to now, which checks to see if there's viral RNA particles present. So it can detect if you have the disease or if you had it. And there's a number of people who are walking around recovered, feeling great after having suffered a number of days or weeks with COVID. And they've gone back to be retested and they still have the virus present. So the only point I make is the testing is critically important. We need to do it on lots of people. We need to generate a lot of data to know what it actually means.
Thank you.
And not only that, just to add something, a test that's negative today doesn't mean it's negative next week. I mean, you can all you have to do is go into a supermarket and get infected. And also for us to really have confidence to send people back into, try to get everybody somewhat back to society, what I have heard, and Dr. Schillinger, you can confirm this, is that along with the testing, we're going to need surveillance because there needs to be follow-up. If you test positive, then we need healthcare workers who are going to go and say, hey, who have you come in contact with? So I mean, it's not just testing; it's testing and surveillance.
It's a complicated process, as you suggest, and you'll need the surveillance, and you'll need more tests so you can be followed up a few weeks later and a month later to see what the status is at that point.
This is Arlene Houston. I just heard, I think tonight, I don't know if it's Johnson & Johnson, but they have the testing from saliva to spit into a cup rather than go up the nasal cavity. So I don't know, other than having heard a flash on that tonight.
Well, there's I think about 70 to 80 companies now who have applications before the FDA for a variety of different tests. So that's a good thing. Hopefully we'll find out that these are all good tests, and that of course is another problem when you fast track everything, just like with the therapeutics. A lot of people are pushing for different drugs. I want the Plaquenil because I heard that that's going to cure this. The data is very iffy on these things. There are people who will swear that it worked well for them. There are people who tell you, no, it didn't do anything. So same thing with the testing. It's going to take some time to really figure out which are the good ones and what the data actually means.
So let me jump in real quick. And Congresswoman, this one is for you. Rachel mentions about Florida's unemployment benefits, let's see, not being retroactive. And so that's, but I'm sure that's not just a Florida phenomena. Are you all looking into allowing folks to recoup that kind of money in order to help them with their normal expenses?
Yeah, Florida is not retroactive. They are now, what they're saying is they're gonna pay you for from the time you started to process your claim. We have written to part of our letter that you'll see is a request that they make the benefits retroactive, especially since some people have been taking weeks to even file a claim. But that is one of the shortfalls. I guess as it stands now, the unemployment is probably going to go on for, I would say, for more than the 12 weeks or even the 26 weeks that they'll get with the federal addition. But yes, that is one of the issues that we're trying to get the governor to take. He could do that in emergency order. That's another issue that League of Women Voters could absolutely follow up on.
Let's see. This one would be for Dr. Schillinger and Brent. We see the numbers climbing every day. In one line of thought, that's a good thing, and another, that's a bad thing. The results from the testing is giving you more data to make more sound recommendations to the general public. Is that all that is good for, or are things still really getting bad?
Well, it is good to generate the data so we can have what we call, appreciate the epidemiology of the situation. And if you find certain clusters of individuals with the disease, those communities can be especially targeted. It's also, the testing is beneficial to determine if somebody does not have the virus and who's like working in a first responder status or working in a hospital so that they're not spreading the disease. Is that the question, what they're saying? I think part of the question is that the numbers are going up. The numbers are going up to some extent because there's more testing going on, but that may be just the number of asymptomatic cases that haven't converted to something more serious. So yeah, the data can be confusing.
Thank you. Here's one from Sister Catherine. We know you mentioned mobile units just now, Congresswoman. But,
Yeah.
and you're well aware that we have parts of the county, such as the Glades, that can truly benefit from, and that may be close to the only resource they have. Anything within the bills or any work getting done to help them out there get tested?
We just, I just got off a conference call this afternoon that was pretty much, that was the focus of our call, was how do we reach some of these, some of the rural areas, some of the areas where people cannot jump in a car and go get tested. So that is something that we're looking to see if we can make that part of our next piece of legislation, because we are going to send, we're trying to send another $100 billion back to hospitals and community health centers, and it would probably be used by community health centers to use vans. So it's something top of mind that we're working on now. And incidentally, just to let you know, some community health centers are doing this. There's a program we heard about today in Vermont where they are taking the van with professionals, and they'll ride into a community and basically set up a tent and do testing that way.
And I think with the availability of all these much faster rapid antibody tests, that through those resources, we'll be able to go out into the community and literally test thousands of people.
Brent, for you, I think myth versus fact is really an important conversation for the folks here. How much should we bank our hopes on the antibody test and it being a solution or a possible cure for folks who are in the most severe conditions?
Well, I think we have to be patient because a lot of this is just going to take time to play out to see how effective, how accurate some of this material is. I know you and I discussed this earlier. People who are showing positive antibodies through an antibody test, their serum could perhaps be used through a transfusion to a person with the disease to give them active antibodies. I wouldn't say that we're at the point now where someone should get online for that type of therapy. It's being investigated as we speak, and there's a great deal of hope in that venue, but it's another thing that takes time. People have to realize, even with the technology we have, we still have to evaluate these results through the proper research. We go look back at the Ebola virus situation. They never really found any type of vaccine or treatment for that because people were so quick to hop on the bus with whatever they thought was going to treat it that we're now left with, if that ever were to come back in force, we don't really have a great treatment. So for this COVID-19, we really have to be patient. And I can tell you there's a lot of very smart people who are working on that aspect. So that's a good thing.
And I think we're getting close to the last question. And Congresswoman Frankel, you mentioned the benefits, and there are huge benefits to telemedicine and the potential future use of that. However, focusing again back towards some of our rural communities here in Florida, as well as other states, internet, broadband availability, is there a potential tie-in during? I know that's a hard question and it's shifting off a little bit, but they really go hand in hand.
Yes, they do. You know, as I said, it's, you know, there is not any simple answers or solutions. Yes, obviously there is a dearth of infrastructure that especially hits the low economic folks. I mean, not only not having necessarily the broadband available, but think about most of our children are now forced to have virtual education, and you still have plenty of kids who do not have access to the internet. They don't have the devices that they need or the connection. So it is just to let you know, we talk about all these issues. I mean, there's so many. It's mind-boggling. But I know that we will have an effort to try to fix some of these problems. But again, because we are not in session, the only action that we can take is where we will have unanimous consent, where everybody agrees. So that stymies us in a lot of areas.
To speak on telemedicine very briefly, through the Palm Beach County Medical Society, we have a COVID resource center that we've set up, and there's a subcommittee specifically devoted to telemedicine. I can tell you a very large number, if not majority, of physicians here in Palm Beach County are participating in telemedicine for their patients. And what the federal government has done through Medicare is they've loosened up a lot of the regulations. It used to be you had to have a specific video link through the computer and everything. Now it's pretty much down to the point where we can just make a phone call and we can still be reimbursed for that, and we can still help the patients. And you know, even the people out in those rural areas who don't have computers, most of them have an iPhone somehow or another. And through the various technology on the phone, I will tell you that we've made a commitment to physicians in Palm Beach County to be available in telemedicine. So it's an interesting thing that has been accelerated through the whole COVID process. And I think going forward, this is going to really jumpstart us into that arena.
And hopefully, so Dr. Children, somebody could actually use a cell phone to do that, right? Because you could use let's say an AT&T connection. You don't need to have a internet connection. Is that right? Or
that's correct. You know, originally there was concerns with HIPAA compliance and concern with meeting all these other Medicare requirements. They've pretty much loosened up on those requirements because this is such a critical need at this point. So people could do that right through their phones, absolutely.
And it doesn't have to be just on COVID. In other words, your doctor can talk to you and treat you if it's appropriate, any medical condition. Is that right, doctor?
Oh, absolutely. You know, the reason that they're switching to telemedicine is largely because many of the offices have shut down or gone to a very limited schedule just to help keep the virus situation at a minimum, part of the social distancing being practiced by the physician's offices. So that telemedicine feature would be available for any type of condition whatsoever, yes.
And keeping with my promise to let you go on time, Congresswoman Frankel, I need to.
You know what? There's one guy, there's a fellow, I think named Rolando, who's been trying to ask a question. So why don't we let him do the one?
Lois, welcome. It's lovely to see you. I have a big meeting coming up, and the first time with the whole Hispanic caucus and chapter with new administrators here and in state. So it's a complete clean slate. But with that said, we have a lot of business people that are home doing absolutely nothing but asking questions and pretty much hating on Keith James, because Keith James is only talking about the revenue, high revenue hotel, restaurant, and bar businesses and saving them and promoting, supporting them, doing all these programs, the EAT program and all this stuff, while everybody else's business outside of Clematis Street is going to end up boarded up. And he doesn't address them. And we've tried calling his office. So my question is, why? What do we do? What do I tell my constituents, my people?
Okay, so the West Palm Beach, their program is a very small program. What I tell your people is this. I don't know if you were on for the earlier part of my presentation. There's two very significant federal programs. Yeah. One is the Payroll Protection Program.
No, I heard all that. And that information has been passed along already.
What's that called?
Yeah, no. I have been listening, and I didn't know about the PPE, which you clarified. Yeah, you clarified the PPE program, which is
PPP, different than PPE.
PPE.
Okay, here's what I would suggest for your folks. Send them to my webpage, I guess to my Facebook page. We did 1 hour of very, very detailed question and answers on small business relief. And if they, now, I would suggest that, or do we have, do they need interpretive, are there folks who are only Spanish speaking?
A lot of them only speak Spanish, but some of them are bilingual.
Okay, so there should be, the SBA should have bilingual
It does.
Webinars. Is any?
Oh, not webinars. They haven't had bilingual webinars yet, but they do have information in Spanish.
Okay, they do.
Yeah.
So that's, I would say, watch my question and answers. The other thing is tomorrow night, or tomorrow at 3:30, I'll be having a town hall. And once again, we will have Mike Mahy, who is the CEO of the small business program here in the area. Okay. And he will be on live to answer questions. So that's two opportunities. Also, if you go on to the website, their SBA's website, you're supposed to be able to, I say supposed to, they have technical assistance. It is hard to get through, but he promised that they call everybody back. Yeah. So there are some avenues to try to get the technical assistance that you're looking for. But really, those two programs, and there's, as I said, plenty of information on the web on that, the PPP, whatever it's called, and the EIDL program, that's the emergency assistance.
Congresswoman, this is Josh Cohen. Can I just say one thing to Rolando?
Yes.
Rolando, there actually is a Spanish language webinar that the SBA is hosting tomorrow morning at 10 a.m. and we'll, or at 11 a.m., excuse me, and we'll send you the information right after this call.
Okay, well, thank you. I appreciate it. And then I could blast it out tonight.
Okay, so we've covered quite a few topics, and you've been a great source of information, Congresswoman Frankel, and you, Brent, as well. I want to remind everyone, though, that the U.S. Census Bureau has kicked off the 2020 census. So now is the perfect time to complete the census for your household while most of us are at home. You can respond to the 2020 census today, either online or by phone, all without having to meet with the census taker. Take advantage of it. A lot of the funds and stuff we're talking about tonight are affected by how completely we count our citizens here in Florida. Again, thank you, Congresswoman Frankel and Brent, for a wonderfully and informative conversation.
Thanks, Carol, for your sign.
That's Patty. She's got them
Patty.
there.
Oh.
Yeah.
I see. Thanks, Patty.
Please join us again.
Everybody have a great night.
Okay,
Stay
please
safe.
join us again every Wednesday for our telecons at 6 p.m. We'll continue these as long as they're needed. Next week, we'll be discussing how some unsavory characters are using this pandemic to try to trick us into becoming victims of identity theft, fraud, and scams. We have a guest speaker online for next week, and we hope that you'll join us. Folks, I'm Ken Thomas, and on behalf of the League of Women Voters and the Healthcare Committee, thank you for joining us. Have a wonderful evening.
Thank you. Good night.
Thank you.
Good night.
Good night now.